Hello everyone, this is Karthika. Welcome to my channel Rimkat. Today I am going to say about ears, second part of the sense organs. First, what is an ear? The ear is the organ of hearing and in mammals helps in maintaining balance. In mammals, the ear is usually described as having three parts: the outer ear, the middle ear, and the inner ear. The outer ear consists of the pinna and the ear canal. Since the outer ear is the only visible portion of the ear in the most animals, the word ear often refers to the external part alone. The middle ear includes the tympanic cavity and the three ossicles. The inner ear sits in the bony labyrinth and contains structures which are key to several senses. The semicircular canals, which enable balance and eye tracking when moving, the utricle and saccule, which enable balance when stationary, and the cochlea, which enables hearing. The ears of vertebrates are placed somewhat symmetrically on either side of the head, an arrangement that aids sound localization. Structure: outer ear. The outer ear is the external portion of the ear and includes the fleshy visible pinna, also called as the auricle, the ear canal, and the outer layer of the eardrum. Two sets of muscles are associated with the outer ear: the intrinsic and the extrinsic muscles. In some mammals, these muscles can adjust the direction of pinna. In humans, these muscles have little or no effect. The ear muscles are supplied by the facial nerve, which also supplies sensation to the skin of the ear itself, as well as to the external ear cavity. The great auricular nerve, auriculotemporal nerve, and lesser and greater occipital nerves of the cervical plexus all supply sensation to the parts of the outer ear and the surrounding skin. Fun fact: in olden days, teachers used to twist the ears of inattentive students. As the nerves become active and the person will become alert. Middle ear. The middle ear lies between the outer ear and the inner ear. It consists of an air-filled cavity called the tympanic cavity and includes three ossicles and their attaching ligaments. The auditory tube and the round and oval windows. The ossicles are three small bones that function together to receive, amplify, and transmit the sound from the eardrum to the inner ear. The ossicles are the malleus, incus, and the stapes, also called as hammer, anvil, and the stirrup. The stapes, also called as stirrup, is the smallest named bone in the body. The middle ear also connects to the upper throat at the nasopharynx via pharyngeal opening of the eustachian tube. Fun fact: do you know why sometimes our ear gets blocked by mucus, which is present in our nose, as the tract is connected to ears, eyes, and nose? So, to clear that, if we take a deep breath and a sudden burst out by closing our nose, it gets unblocked. Inner ear. The outer ear receives sound transmitted through the ossicles of the middle ear to the inner ear, where it is converted to a nervous signal in the cochlea and transmitted along the vestibulocochlear nerve. It sits within the temporal bone in a complex cavity called the bony labyrinth. A central area known as the vestibule contains two small fluid recesses, the utricle and saccule. These connect to the semicircular canals and the cochlea. There are three semicircular canals angled at right angles to each other, which are responsible for dynamic balance. The cochlea is a shell-shaped organ responsible for the sense of hearing. These structures together create the membranous labyrinth. Blood supply. The blood supply to the ear differs according to each part of the ear. The outer ear is supplied by a number of arteries. The posterior articular artery provides the majority of the blood supply. The anterior articular arteries provide some supply to the outer rim of the ear and scalp behind it. The middle ear is supplied by the mastoid branch of either the occipital or posterior auricular arteries and the deep auricular artery, a branch of maxillary artery. The inner ear is supplied by the anterior tympanic branch of the maxillary artery, the stylomastoid branch of the posterior auricular artery, the petrosal branch of middle meningeal artery, and the Limbrannide artery. Hearing. Sound waves travel through the outer ear, are modulated by the middle ear, and are transmitted to the vestibulocochlear nerve in the inner ear. This nerve transmits information to the temporal lobe of the brain, where it is registered as sound. Sound that travels through the outer ear impacts on the eardrum and causes it to vibrate. The three ossicles bones transmit the sound to a second window, that is the oval window, which protects the fluid-filled inner ear. In detail, the pin of the outer ear helps to focus a sound which impacts on the eardrum. The malleus rests on the membrane and receives the vibration. This vibration is transmitted along the incus and stapes to the oval window. Two small muscles, the tensor tympani and the stapedius, also help modulate noise. The two muscles reflexively contract to dampen excessive vibrations. Vibration of the oval window causes vibration of the endoliph within the vestibule and the cochlea. Diseases: acoustic neuroma, osteosclerosis, middle ear infection, benign paroxysmal positional vertigo, blast injury, inflammation of the ear canal, Marie's disease, presbycusis, hypoacusis, cholesteatoma. Treatment: most ear infections go away on their own, but some require medicines or medication. Some of the medicines are analgesics, which relieves the pain. Non-steroidal anti-inflammatory drug relieves pain, decreases inflammation, and reduces fever. Penicillin stops growth or kills specific bacteria. Local anesthetic blocks pain at and near the site where it is given or along the nerve that's blocked. Antibiotics stops the growth of or kills bacteria. Precautions: avoid keeping of sharp objects like keys, sticks, screwdrivers, etc. in the ear. Avoid use of earphones that have high bass. Cleaning of earwax using natural ways. Thanks for watching. Please like, share and subscribe, and please hit the bell icon for more new updates. See you in the next video.